hot mess. I thought we'd be on video to that.
Did you scan my ID? Okay. Hello, my name is Leigh Griffin, and today I'm going to talk to you about stereotactic radiosurgery. CBTRUS, or the Central Brain Tumor Registry of the United States, stated on their website, www.cbtrus.org, that as of November 2014, that nearly 70,000 new cases of primary brain tumors will be diagnosed this year. More than 4,600 children between the ages of 0 to 19 will be diagnosed with a brain tumor this year, and there are more than 120 types of brain tumors. Brain tumors, as with all types of cancers, do not discriminate. This list of sobering facts is something that I see on a daily basis in my career, and stereotactic radiosurgery is one of the treatments available for these types of tumors. Stereotactic radiosurgery, or SRS, is a non-invasive outpatient procedure and is used to treat brain tumors and some spinal tumors with minimal to no recovery involved. Today I will discuss with you what stereotactic radiosurgery is, what it is used for, how it works, and some of the pros and cons involved. To start, I will explain what SRS is. Wikipedia, the online encyclopedia, states that SRS was first developed in 1949 by a Swedish neurosurgeon, Lars Lexell, to treat small targets or tumors in the brain and that were not amenable to conventional surgery. The UNC School of Medicine of Chapel Hill states on their website, www.med.unc.edu, that stereotactic radiosurgery is a procedure utilizing very accurate targeted radiation in large doses to effectively kill or destroy a lesion in the brain and in some cases on the spinal cord. This method is used to kill tumor cells by slowing or stopping the tumor growth. SRS has been used in the United States since the mid-1980s. Now let's discuss what stereotactic radiosurgery is used for. SRS is used for the treatment of brain tumors and some spinal cord tumors. On the American Brain Tumor Association's website, www.abta.org, for 2012, their definition of a brain tumor is described as a cancerous or malignant or non-cancerous or benign mass or growth of abnormal cells in the brain. Examples or types of brain tumors that SRS is used to treat is primary, which are cancers that start in the brain. Yes. Okay. Such as gliomas or other primary brain tumors. Metastatic, which is cancers that spread to the brain from other parts of the body. These are known as brain mets. Meningiomas, which are benign tumors arising from the membranes covering the brain. Acoustic neuromas, or vestibular schwannomas, which are benign tumors of the inner ear. AVMs, which are arteriovenous malformations, which are abnormal blood vessel clusters in the brain. AVFs, which are arteriovenous fistulas, abnormal channels or passages between the arteries and veins in the brains and spinal cord. A side note to this is both AVMs and AVFs pose a high risk for rupture and hemorrhage inside the brain if not treated. Pituitary adenomas, which are tumors of the pituitary which can be benign or malignant. Optic nerve or retinal tumors, which are tumors of the nerves behind the eyes. And other tumors such as pineal tumors and skull-base tumors. This is only a portion of the more than 120 types of brain tumors. I found this list on the www.radiosurgery.net website. Also on this site, it discusses how stereotactic radiosurgery can be used alone as a singular treatment or in conjunction with invasive surgery and or conventional radiation therapy as a boost or a supplement. SRS can be used post-surgical to clear out residual tumor cells. SRS can be used post-conventional whole brain radiation therapy to treat a new tumor or retreat an existing tumor, as conventional whole brain radiation can only be done one time per person. However, stereotactic radiosurgery can be repeated over and over on a person due to its precision by avoiding previously irradiated areas. Stereotactic radiosurgery can be used alone to treat tumors that are inaccessible by invasive surgery, on patients who are not surgical candidates based on their health status, and on patients who do not want to undergo invasive surgery and recovery. Next, I will explain to you how stereotactic radiosurgery works. The IRSA, International Radiosurgery Association, states on their website, www.irsa.org, that like conventional radiation, SRS does not remove the tumor lesion, but it actually changes the DNA of the tumor cells. These cells lose their ability to reproduce and in turn shrink. The tumor shrinks at the same rate at which it would grow. Benign tumors and vessel clusters, such as AVM and AVFs, which are typically slow-growing, take around 18 to 24 months to shrink away, while malignant and metastatic tumors, which are very fast-growing, can show changes in as little as 2 months. There are 3 basic forms or types of stereotactic radiosurgery. The Colorado CyberKnife website, www.radiosurgery.net, briefly tells of these types of stereotactic radiosurgery systems. The particle beam or proton, which is very expensive, and there are not many of these available in the U.S. A positive is that this form can also be used to treat other types of cancers throughout your body. Very little research has been able to be done on this mode of stereotactic radiosurgery, as it holds a price tag greater than $100 million. The cobalt-60 based or photon system, which is very good for treating tumors less than 3.5 centimeters, these are considered small tumors. The most popular brand name synonymous for this type is the Gamma Knife, and the linear accelerator system, or the LINAC, which is very good for treating tumors even larger than 3.5 centimeters and can also be used on other parts of the body other than just the head and neck. The popular brand name synonymous for this type is the LINAC Scalpel, CyberKnife, and Novalis. Coincidentally, the LINAC Scalpel mechanical system was developed and patented locally by the University of Florida Department of Neurosurgery. It improved accurate delivery of radiosurgery treatment, as well as the first true dedicated computer dosimetry program dedicated to radiosurgery optimization. This system is now marketed by Avarian Systems, states the Department of Neurosurgery, University of Florida's website, www.neurosurgery.ufl.edu. It also tells here the makeup of a typical SRS treatment team that normally put someone to sleep. Normally consists of a neurosurgeon, a radiation oncologist, medical radiation physicist, dosimetrist, biomedical engineer, and a computer programmer. According to the ABTA, the typical SRS treatment only takes around 15 minutes to 2 hours, including a local anesthetic for a head frame placement put in place with pins. This keeps your head completely still during the treatments. Imaging of the tumor location, computerized dose planning, and radiation delivery. In addition, we should look at pros and cons considered in using SRS as treatment. I compiled together some pros and cons from several different contributing websites as they run concurrent with each other. I collect this information from www.radiologyinfo.org, www.radiosurgery.net, www.aans.org, and www.abta.org. The pros include no healing time or incisions, can quickly control tumors to allow time to treat the primary cancer, such as brain mets, can be repeated over and in patients who have already undergone conventional whole brain radiation or received maximum radiation doses, precise, minimizes effects to normal healthy tissues, only follow-up is occasional imaging scans to check tumor status, outpatient procedure, only discomfort is from the head frame with possible headache after, can treat multiple small tumors with 1 session, no risk of infection, and shorter recovery time. As with all procedures, there are cons. Swelling is possible due to the cells of irradiated tumors losing the ability to regulate fluids. This is treated with a course of steroids. Necrosis is the tumor tissue that remains and typically shrinks. On rare occasions, it does cause problems and requires a procedure for removal called debulking. Radiation overdose is possible due to inadequate safeguards and equipment retrofitted for SRS. Immediate possible side effects from SRS include nausea and vomiting, temporary hair loss in the area that was treated, headache, soreness from your head frame, increased intracranial pressure, orthostatic hypertension, seizure, edema or swelling, necrosis, or neural tissue injury. These may occur during or immediately after treatment and are typically gone within a few weeks. In conclusion, today I have shown you that stereotactic radiosurgery is a non-invasive outpatient procedure used to treat brain tumors and some spinal tumors with little or no recovery involved. We have talked about the background of SRS and what it is, what brain tumors are and what SRS is used for, how SRS works, and some pros and cons associated with the procedure. Thank you for your time.